Hello and welcome to another episode with the Nairobi Hospital. I'm your host, Modoni Bobero. Today we will be discussing about congenital heart disease and rheumatic heart disease. I'm joined by Dr. Osoro Mbui, who is a clinical administrator at the Nairobi Hospital. Karibu sana daktari.
Thank you.
To start us off, what is congenital heart disease?
So congenital heart disease is a heart disease that comes about when a child has been born because of poor development inside the mother's womb. So you'll find these children have been born and for some reason they either can't breathe well or their heart is beating and there's a lot of noise as you listen and examine them, and it affects their eating, their breathing, and sometimes even how they grow. Yeah.
What of rheumatic heart disease?
So rheumatic heart disease, unlike congenital heart disease, is an acquired disease. You're not born with rheumatic heart disease, but you get it as you grow up. One of the biggest risk factor is continuous upper respiratory tract infection, or what we call the flu. So flus that are not treated over a period of time can lead to the heart getting affected on the valves and causing rheumatic heart disease. Again, giving symptoms very similar to congenital heart disease. However, this happens later on in age, usually from around the age of 9 years old. Yeah.
With a congenital heart disease being something that you are born with, what are some of the effects that it can have on the child's heart?
The way the heart is created is to pump blood to the rest of the body. So any structural abnormality, because that's what congenital heart disease is, means the heart cannot pump blood the way it ordinarily would. Therefore then, there are two kinds of congenital heart disease. There are those that we call cyanotic, where the baby turns blue. Those are the easiest because you see it when the child is born. And then there are those we call acyanotic, meaning that they do not cause the child to turn blue, and those are picked later on. However, if you have a clinician who is aware of it, like all our pediatricians can, they will be able to pick it at birth, even if the child does not turn blue. Yeah.
What of rheumatic heart disease?
So the signs and symptoms of rheumatic heart disease again will differ because it depends on which part of the heart has been affected. As I had said earlier, it affects the valves. So if you remember your science, you have the aortic valve and you have the mitral valve. And therefore, depending on which valve is affected, you could either have difficulty in breathing when the child exerts, maybe trying to run or walk fast or play. You could have easy fatigability, getting tired very easily. You could have, in due course, swelling of the limbs or the child swelling. And you could also have failure to grow, because as this blood is not pumped around the body well, it means the child cannot eat or doesn't eat well and therefore doesn't develop well. So these are children who you will find a child who, for example, is the age of 9, looks like a 4-year-old, and you wonder what is it, what we call failure to thrive.
Okay. Yeah. What are some of the treatments available for, let's start with the congenital heart disease?
So for congenital heart disease, because it's a structural abnormality, it means you must go and correct the structural defect. And for that, it's usually open heart surgery, which is available in our country in various centers. And you've heard of people saying there's a hole in the heart, so you go and fix that hole. Or the way the vessels are sitting is not right, you go and reposition them. That's what's available for congenital heart disease. Yeah.
And is it an expensive treatment? Are there available funds to assist those who are even not able to maybe fund themselves?
So yes, open heart surgery is an expensive affair. And yes, there are funds that are available. One of the good things that our government did in 2016 was the universal health coverage and opening up the NHIF in celebrating NHIF at 50. So that opened up funding for specialized surgeries, and open heart surgery was one of their pilot projects, which I think we gained a lot of milestones from. So there is funding through the National Health Insurance Fund, and then we have a number of good wishers who also fund the same. So like at the Nairobi Hospital, we have the Charity Heart Fund, where we get a lot of corporates and partners who work with us. They donate money, which goes into the program, so that for children who have this condition, either congenital heart disease or rheumatic heart disease that has affected the valves, they're able to fund for these procedures to be done. Unfortunately, for congenital heart disease, insurance companies don't cover. However, they also do partner with us by contributing towards the Charity Heart Fund, but you will not find it as your regular coverage because they generally do not cover for congenital conditions, whether it be heart disease, whether it be cleft lip or cleft palate. Yes.
So what is the criteria used so that the people who are in need of the services get the services or the funding?
So it's first for Kenyans only.
Okay.
We start there. It's important to state that because we've had a few foreigners come to ask if we can share it, but it's for Kenyans. Children aged between 0 and 17 years of age who come from needy homes. And needy homes varies, as you know. I could be needy and I don't appear to be needy. So those are the people who are eligible for the fund, and they must also be eligible for the surgery. So once they apply, anyone who applies who has a child within that age are invited to come. They're reviewed by our pediatric cardiologist, who's then able to, once she has assessed and feels this child will benefit from surgery, then we'll send to the cardiothoracic team that will evaluate for suitability. And then that team, once the team has agreed that clinically the child can benefit, then we have a social worker who evaluates. Since this is hard-earned money from the corporates, we have a responsibility to be accountable for it, and therefore we also have to do due diligence. So once they've had a social worker evaluation, then we are able to schedule the procedure. Yeah.
So this year we have an annual event towards the Charity Heart Fund. You could mention something about it.
So every year we hold a charity golf tournament where we invite our partners who help to sponsor for the program so that we can continue to raise money for this noble cause. This year we hope to do it on 26th July. You're welcome.
I'll definitely come.
Yes, and we also try and get some of the beneficiaries of the fund to come so that those who have sponsored the program can also be able to see the beneficiaries of the fund.
Now on the rheumatic heart disease, what are the treatments available for the disease?
So because rheumatic heart disease mainly affects the valves, when it comes to the heart, it affects other parts of the body. But because we are focusing on the heart today, I'll just dwell on that. So once it affects the valves, it means they do not open and close as they ought to, which means it affects flow of blood through the body. So the treatment for that is to actually replace the valves. So once the children have been found clinically suitable for the procedure, then our team goes in, removes the diseased valve and replaces with another valve. An important thing about rheumatic heart disease is that once those children have had the surgery, they have to be followed up for life, because the valve, in as much as is a good valve and is helping them live a normal life, we have to give them anti-clotting medication so that they do not form clots and later on get side effects. Therefore, part of the social worker evaluation and counseling for these patients is to tell them that once we've done this surgery, you cannot go away scot-free. You must continue follow-up with your doctor. Initially, it may be after 2 weeks, a month. As you're getting stable, of course, it gets staggered to a point where it's possibly just once a year, but it is a lifelong follow-up because you have to be on anti-clotting medication. If not, we can actually lose you. Yeah.
Do people who suffer from these special conditions, do they have to follow a specific life or rather dietary for them to keep healthy?
So yes and no. So the yes is you have to eat healthy. You're the kind of person we do not want to get obese because you will overwork that heart. We've already intervened in that heart. No, in terms of, we will not tell you to have a special diet, so you can eat normal food, but eat a balanced diet in moderate amounts so that you can maintain health but not get obese. Yeah.
Back to the congenital heart disease.
Yes.
Most of it is noted or realized during pregnancy. Is there something that can be done to avoid that situation?
So it's interesting, it can be noted during pregnancy at 28 weeks. During pregnancy, the 28-week scan usually checks for any anomalies in the child. And it may be picked, but sometimes it may not be picked depending on which kind of anomaly it is. Because like for holes in the heart, while the child is in the womb, you may not pick because the circulation is going on well. And even when they come out, there are some holes in the heart that we may not fix, but we will give time and they actually close spontaneously. But there are some that we can actually pick in the uterus based on ultrasound. It's important to note that ultrasounds are very user dependent. So you may do an ultrasound and you find a lesion, and I do and I don't find a lesion. However, we keep training our team so that they can be able to pick some of these lesions, to be able to assist the family and to help us plan on how to manage the child. Yeah.
What is the prevalence rate of infections, or rather of these diseases, both congenital and rheumatic, in terms of regions and the ages that are mostly affected?
So for rheumatic heart disease, because I told you it usually comes after a child has had upper respiratory tract infection that's not been treated for a while or well treated. The commonest age that has been found according to research is the age of 9 when you develop it. However, there are people who live to adulthood with this congenital anomalies. Maybe they were not picked, or if they were picked, they didn't know where to go. And therefore, even a lot of the valve replacements that we do in adults are due to rheumatic heart disease that they picked when they were younger. Yeah. In terms of congenital heart diseases, there was a research that was done at the University of Nairobi a few years ago that was able to pick that 25% of the heart diseases we have in Kenya are actually congenital heart diseases. In terms of region, we were not able to delineate which is the more prevalent area. So right now, we just pick them as they are. So for example, in Nairobi Hospital, we may have procedures on a lot of children from Central and Eastern, but I will say it's largely because those are the closest counties that to the hospital. Because if you go to Eldoret, they also have a cohort that is coming from the Rift Valley area. If you go to Kijabe, there's also a cohort. So we don't have data to say this is the area that has the higher prevalence or not, so that we can advise people be careful. But then again, we know there's the challenge of migration back and forth. So really what we encourage is consistent or focused antenatal follow-up, so that the mother, within the first 12 weeks of pregnancy, because that's when the organs form, you'll find the obstetrician or the midwife will advise on taking things like folate, iron, eating healthy so that the child can develop well. Then an ultrasound being done at 28 weeks to be able to guide us, what are we to do? In Kenya, abortion is illegal. So for us, it guides us and prepares us for conditions where maybe if you're born, we can actually go straight to theater and try and rectify the anomaly. And we have done that in 1 or 2 cases where we were lucky to pick it within the pregnancy period, so that child is born, we already had a consent once baby is out, we can go straight to theater, let's fix this anomaly so that the child recovers and they go home well with mommy and she doesn't have to wait and struggle. So yeah.
And that's it from this episode with the Nairobi Hospital. Today we have learned so much about the congenital and the rheumatic heart conditions. For more information, you can visit the Nairobi Hospital's website, that is www.thenairobihospital.org. Thank you very much, Daktari, for joining us today and for sharing with us that insightful information.
You're welcome. Thank you too.
Thank you very much. That's it. Ciao.